Hi, my name is Steve Greenfield, and this is my channel, Another Lump on the Road. So here we are. This is episode 9, and I've hair, eyebrows are big. It look like they thinned a little bit, chest, torso, an area they've thinned. They haven't really lost the hair like I have on my face and on my head. One of those things, I guess. Feeling good though. I feel really, really good. So no worries there for friends and family who are watching. I feel fantastic. I feel like me, as opposed to a couple episodes back when I had a really rough time with chemo. But chemo's over, like I've said before. Chemo's done, and I feel well. And a couple of days ago, I went to Ochsner in New Orleans to get my PET scan, and lo and behold, like 3 or 4 hours after the PET scan, they contacted me with results. And Dr. Carter Davis over there at Ochsner, he told me, he relayed that if you're going to get a PET scan and you want it to look good, this is exactly what you want it to look like. So I'm happy to say that I am 100% in remission. So that is great news. The cancer is gone out of me at this time, and that clears the way. Many people have asked, well, you're in remission, so you don't have to do all the other stuff with the stem cell transplant. No, this just clears the way for me to have a stem cell transplant. Just to be clear, I had chemo to get rid of the cancer. If I only did that, then since it came back within a year so quickly, the chances are exponentially higher that in another year I'll have cancer again, and every year afterwards or sooner or whatever it may be. So we're being a little more aggressive this time, and they had to get me in remission first, so it paves the way for me to have the autologous stem cell transplant, where I provide my own blood and my own stem cells. Basically, they take it out of you and they put it back in you again. It's like a transfusion with your own blood. So the fact that I'm in remission does not mean that I don't have to do the stem cell transplant. It just clears the way and makes it okay for me to be a patient for a stem cell transplant. There are other things to do too. I had a bone marrow biopsy the same day as the PET scan a few days ago, and I don't think anything was really weird found on that, so nothing came back from that. But I still have to have an EKG and an echocardiogram and a heart x-ray, and I have to meet with doctors and dietitians and so on and so forth. That's going to be this coming Friday. That's about 5 days from now. Long day. That's the 14 appointments in one day kind of day. So we're going to knock a lot of stuff out. And I have a few tests after that too I have to do, but we'll talk about that later. But feel good. I want to talk to you about the bone marrow biopsy. If you're looking at doing an autologous stem cell transplant, or either kind of stem cell transplant, or even if you just found out you've had cancer, you probably will have to have a bone marrow biopsy. The doctors are very calming and soothing, and they tell you, you're going to feel some pressure, a lot of pressure, nothing they could do with that. I've had one before. I had one a couple years ago when I had cancer the first time. This time, I was familiar with what a bone marrow biopsy was. Basically, they lay you down, they make a small, tiny little cut into you, and they put a needle. They put a needle into your lower back, like above your butt, and they put a needle into your pelvis and that bone down there, and they take the needle into the bone, and they extract some bone marrow for testing. And they tell you, oh, you're going to feel a lot of pressure. And you do feel pressure because they give you a lot of local anesthetic. So with them doing that, when they're needle and so forth, they're getting all that done, it feels like a knuckle, like being pushed really hard on your bone. So yeah, you feel all that. It's not painful, but it's just uncomfortable. But when they extract the bone marrow from your pelvis, it hurts. I'm sorry, but it hurts. There are people in there to kind of make sure you don't jump out of the bed. It's okay to scream, curse, cuss, whatever. I think I said something. I'm not really sure. I was kind of blinded with a quick bout of pain, but it does. It hurts to come out. It's very brief. It's, it lasts a few seconds. It's not something that you're going to feel for days and hours or minutes. It's just a few seconds, but it does. Every time they make it a little extraction, there are a lot of nerves inside your bone marrow, whole network, a net of just many, many millions of nerves down there. So when they pull it out, it is painful. So be prepared for that. It's okay. Ask them if it's okay if you take some kind of pain reliever before your appointment, a couple hours, hour or two before your appointment. Can you take some ibuprofen or some Tylenol before you go? Ask and find out if that's okay. I didn't do that. I'm one of those, I don't want to take too many pills. I've already had so many chemicals in me as it is. I don't want any more chemicals. But ask about that, and they will tell you you're going to feel pressure. They're not going to tell you you're going to feel pain, but you will. But it's very, very brief, and you're going to want to come up swinging, but just hang in there, just for a few seconds. It'll subside, and it'll feel like that pressure again, and then they'll tell you that they're going to extract a little more, and it's going to hurt a little more, but you're going to be okay. It's going to be fine. But it's not a pleasant experience. I'd rather have an ass kicking than to have a bone marrow biopsy, but had to do it. Got it done. Moving forward, bunch of tests coming real soon. Stem cell transplant still on the way. Collection starts in a few weeks, and I get admitted in about 4 weeks. We got a lot to talk about, a lot of long road to go together. Thanks for listening. Thanks for watching. Hit subscribe so you get a notification that there's another episode. Make sure in your notifications in your phone, you turn on YouTube and hit give you some kind of notification that you have a new video to watch, what have you. Anyway, have a great day. Love you guys. See you soon.